Aloha, Kauai. This is your County of Kauai briefing for Thursday, August 12th. I'm Kauai District Health Office Public Health Preparedness Planner Lauren Guest. We are experiencing a spike in COVID-19 on our island. The highly contagious Delta variant continues to spread at an alarming rate. Most of our cases are in residents. On Tuesday, we confirmed 55 new cases, the highest daily case count since the start of the pandemic, 53 residents and 2 visitors. Wednesday, we confirmed 30 cases, including 28 residents and 2 visitors. Today, we are reporting 34 new cases, 1 visitor, and 33 residents. There are now 193 active cases on island, with 3 hospitalized. Since the start of the pandemic, we've confirmed 841 total cases, with 3 fatalities. The Kauai District Health Office is investigating 3 active clusters on our island. We expect to identify more cases from these clusters in the days to come. One of the clusters is at the Correctional Center, where 33 primary and secondary cases are confirmed so far. An additional round of testing for all inmates was conducted this morning, with results expected tomorrow. Another cluster is in an educational setting, with 22 primary and secondary cases. The third cluster is in a restaurant, where we have identified 12 primary and secondary cases so far. As a reminder, anyone who was at Tahiti Nui Restaurant in Hanalei from July 30th through August 4th may have been exposed to COVID-19 and should be tested immediately. Free testing is available at the convention hall weekdays from 8 a.m. to 3:30 p.m., no appointment needed. If you have symptoms, please isolate yourself immediately and call your doctor for a drive-up test. A full list of testing locations and options is posted at kauai.gov/COVID-test. Mahalo. Now we turn to Mayor Derek Kawakami for an update about Governor Ige's new order.
The governor issued a new statewide emergency order this week due to the spread of the Delta variant. It includes new limits on gathering sizes and restaurant capacity. Effective immediately, social gatherings are limited to 25 people outdoors and 10 people indoors. Restaurants and bars remain open with indoor capacity set at 50%. Gyms and other high-risk indoor activities are also limited to 50% capacity. Professionally organized events will continue per Tier 5 rules, but any event over 50 people will require organizers to submit event information to our Kauai Emergency Management Agency. To submit your event information, visit kauai.gov/COVID-19 and click on the button at the top that says Professionally Organized Events. With school back in session, we all need to do our part to protect our keiki from this disease. If your child is 12 or older, the best way to protect them is to get them vaccinated with the Pfizer vaccine. Vaccines are now widely available island-wide, including pop-up vaccine clinics. This Saturday, August 14th, a team will be at Kamakani Community Hall from 8 to 10 a.m., Anaina Ho Farmers Market in Kilauea from 9 to 11 a.m., and the Hanapepe Hawaiian Church from 1 to 2:30 p.m. No appointments are needed. Adults can choose from all 3 vaccines. For more information, call Ho'olalahui at 808-938-0938. Our new free mobile vaccination van is also open to ages 12 and older. This week, the van will be at Hanapepe Neighborhood Center on Friday, August 13th, and at the Hanalei Neighborhood Center Saturday, August 14th, open from noon to 3 p.m. Vaccines are also available at most clinics and pharmacies. For details on where to get a vaccine, please visit kauai.gov/vaccine. This week, we're launching a new segment called Ask Dr. B. Post or message your questions about COVID and vaccines on our County of Kauai Facebook page, and our District Health Officer, Dr. Janet Berriman, will answer as many as we can. So without further ado, ladies and gentlemen, Dr. B. Dr. B, our first question is, what percentage of the cases on Kauai are people who have been vaccinated?
Thank you, Mayor. I know there's a great deal of interest in this topic. Nationally, more than 95% of those hospitalized with COVID-19 are unvaccinated. Vaccination clearly provides a high degree of protection from severe disease and death. Locally, the Hawaii Department of Health is actively assembling statewide data on breakthrough cases in vaccinated individuals. We expect the Hawaii-specific data to be released soon, but don't know the exact date. We'll provide an update once the data is available.
Thank you. Our next question is, if a student tests positive, are classmates and teachers considered close contacts? What does that look like this school year, especially pre-K through 8th grade?
Whether classmates and others are considered close contacts depends on how much time they spent with the student and at what distance. Health officials and the individual school will work together to determine who the close contacts are in each case. A close contact of a positive case should be tested, and any close contacts who are not vaccinated will be required to quarantine. Others who were not in close contact but are concerned are welcome to seek testing as well. Additionally, anyone who develops symptoms should stay home from school and arrange to be tested. The layered approach to protections can help minimize the number of close contacts. Wearing masks indoors or when in close proximity to others, maintaining at least 3 feet of distance indoors whenever possible, and cohorting students and teachers in small groups all help reduce the number of people who come in close contact with someone who tests positive. As a community, our focus is protecting our young keiki who are not yet eligible to be vaccinated. For those of us who are eligible, we can help protect our keiki by getting vaccinated. Vaccines are our most effective tool to stop the spread of COVID. Mahalo to all the teachers, staff, and students aged 12 and older who have gotten vaccinated. Again, if you're looking to get a vaccine, please visit kauai.gov/vaccine.
Our last question of the day is, when will keiki ages 5 to 11 be eligible to get a vaccine?
Both Pfizer and Moderna are now conducting clinical trials of their vaccines in children under 12 and have indicated that they expect to submit data from the trials in 5 to 11-year-olds to the FDA this fall. Trials in younger children are also in progress, but they're not as far along. From that point on, it's up to the FDA, how quickly they review the information and what they learn in that review. The FDA will not grant authorization for vaccinating 5 to 11-year-old children until they're convinced that the vaccines are safe and effective. Federal officials have said they anticipate approval early next year if the data from the clinical trial proves they are safe and effective in young children. We certainly hope it will be sooner. In the meantime, there are many things we can do to keep these young people safe and healthy in school. Wear masks indoors and at school. Get vaccinated if you're eligible. Stay home from school and work if you are sick. Get tested if you are sick or have traveled or have been in contact with someone who tested positive. Testing is recommended in these situations for everyone, whether you've been vaccinated or not. Thanks for the questions. Keep them coming, and we'll answer more next week. Back to you, Mayor.
Thanks, Dr. B, and thanks to all of you for staying informed and updated as we work together to gain control of this current surge in cases and keep each other healthy and safe. Mahalo for wearing your masks when indoors. Wash your hands, keep your distance, avoid large gatherings, and of course, consider getting a vaccine. Mahalo for helping to keep Kauai safe, and remember, I got vaccinated. And on a final note, a special shout out to Mr. Vernon and Auntie Lynn. Thank you so much for the beautiful mailile and for the pickled plums to Nick and Keiko and the Pananganan Ohana. Thank you so much for that plum jam. It was delicious. Everybody, as we head into the weekend, be safe, enjoy the beautiful weather outdoors, and let's do our part to keep Kauai safe. Mahalo.